This segment of Afternoon Live is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Thanks for watching Afternoon Live. Doctors diagnose more than 3 million cases of age-associated prostate gland enlargement every year. This type of prostate enlargement isn't thought to lead to prostate cancer, but it is a significant lifestyle complication. Here to help us understand the symptoms and treatments is Providence urologist Dr. Nicholas Boncher is with us today. Dr. Nicholas, good to have you on the show.
Hey, thanks for having me. Welcome to the remote world, right?
I know, exactly. Well, and I'm sure this is how you're meeting with a lot of your patients too, as well, initially, and helping them understand what what these things are. So prostate enlargement, take us through what that means, how does it happen, how common it is.
Yeah, well, it's really common. The prostate is a reproductive gland in all men. And so if you're a guy, you've got one. And starting in adolescence, the testosterone surge that happens in all guys, that is the signal for that prostate to get ready for its function as a reproductive organ. Unfortunately, that same amount of testosterone is, for the most part, adequate in the level to allow ongoing growth really for the rest of most men's lives. And so what happens is you have this prostate which keeps growing, and unfortunately, at some level, it can cause problems. Those problems are primarily related to its anatomy, its position inside of our body. And the prostate has this unique position of the tube through which you urinate, called the urethra. That tube passes right through the center of the prostate. And so you can think of it like a core through an apple, or sort of that weird fibrous part that runs through the center of an orange. And over time, as that prostate gets bigger, you've got something getting bigger this way, but it also gets bigger inwardly. And so that growth eventually compresses that core tighter and tighter. And so I think a fruit is a great analogy, because you can think of the pulp getting bigger with less space for that core to be its same size. And so you get this compression on men's streams.
What are the symptoms?
They're variable, but they're all potentially very bothersome. And typically at the beginning, it could be something as simple as a slower stream or a longer time to void. But it can progress, and it can progress rapidly in some folks and slower in others. And eventually it could be something severe as being unable to pass any urine, which is called urinary retention.
So very important, to get to your doctor. I want to be able to get to these treatments though, because we're talking about a huge amount of men who are going to be dealing with this. What treatments are offered? Well,
historically, this problem, of course, goes back to men who lived long enough to be in their 50s or 60s. So we have this problem going back to ancient Egypt. Now, we are better a little bit than they are, but our primary mechanism of treating this is medication up front to sort of relax that prostate and sort of take the pressure off. And there are a couple different types of medications. Some even will shrink the prostate, although those work relatively slowly and don't have quite as much effect on symptoms. They can slow the growth a bit. But primarily, this is still a surgical disease, and that's because of our other medical treatments that are allowing most men to live into their 70s or 80s or even beyond. And medication typically won't be able to go the distance.
What is the Eurolift procedure?
Well, the prostate, again, it's all about knowing that anatomy. So if you have this structure closing inward on the prostate, what we want to do is reverse that. And again, medications can relax it. We have some procedures that can sort of core that back out. But Eurolift is nice because it doesn't remove tissue, and it works, as you can see in the pic. It works because that fruit pulp that has grown over time is compressible. So if you can sandwich each lobe up against itself, you can create a channel down the middle. And the Eurolift does that by using these small implants to help pull the prostate up against itself. And you can think of them a lot like how a drywall molly will work, where it's pinching the drywall in between the two metal pieces in order to keep something stable and to provide it some support. Here, what we're doing is we're pinching the tissue in between these two ends of the implant and moving tissue out of that center area, again, allowing that channel to open up.
Dr. Nicholas, thank you for breaking this down. Appreciate it.
Yeah, thanks. Great seeing you.
You too. And you can call Providence Urology Services, the East Clinic, for an appointment at 503-215-7628. We'll have more information in that number and a link to their website on our website as well, KATU.com. But don't go away. We'll be right back.